One thing that I also found interesting about this that I want to point out, in 2006, Massachusetts passed a very similar bill for a state-level government-run public option, kind of similar what they're working on in a national level, and they are becoming bankrupt. Their insurance premiums have risen to be the highest in the United States, and they're losing coverage, and bureaucrats are fighting between them and their doctors. Exactly what a lot of the opponents have said is happening on the state level, and they don't want to see that happen nationally.
Yeah.
So do you think that the leaders of the Congress are going to listen to this, or are they just going to reform? Because Pelosi, the Speaker of the House, has said that we are going to have health care reform whether we like it or not.
I don't really think they're going to listen. I think they're going to ignore it and push through a bill, do whatever they can.
The leaders, I don't think the leaders will listen, but I think the people who want to stay in office will listen. And I think you're going to have some people who they might, well, you know, I guess it's possible because so many are retiring because they don't think they'll be reelected.
Which is possible.
Yeah, which is very possible that maybe as one of their last, you know, hurrahs that they will vote for it. But so that would be a possibility, but I don't think they're going to get anything as ambitious as they've been trying past.
Right.
They'll get something.
And one last interesting thing I'm going to say about this before we move on is that both leadership, in both party leadership, the Republicans and the Democrats, are claiming different reasons why that happened. The Republicans are saying that people don't want the health care, and the Democratic leadership is saying that people are upset because health care is not passed yet. Which do you think is the natural, like, just from the polls you've read and in your opinion and what you've seen, do you think people are upset because of the bill or because nothing is passed yet?
Like I said,
it's a tough call. It's really just a judgment guess.
I think it's a combination, because you watch the government doing something so incredibly ambitious, but yet so incredibly ineffectual. So it's really, I think, it's irritating on both levels to sit there and watch it. It might be because we pay more attention to it than maybe the average person.
The people are just angry in general.
Yeah.
They don't like anything that's going on right now at all.
It seems like most of the polls, it's at least a 10% on average above thinking whenever they all ask that generic question, do you think the country is on the right track or the wrong track, and blah blah blah. And right now I think the average is 10% above that the country's on the wrong track. I just think it was very ambitious, and liberals are upset that the bill is not ambitious enough and that they can't get it done, that they waited and tried to do the bipartisan thing and didn't just, use their supermajority and shove it through and then let people sit on it. Because one great example that Democrats bring up every once in a while is the Bush prescription drug bill from way back in, I think, his first term. And he passed that, and that's actually fairly liberal legislation. And everybody at the time hated the idea, but it was all, it had Republicans and Democrats involved. They just shoved it through, and then now nobody would touch it because everybody loves it so much. So they should have, I think that's why liberals are at least upset. Conservatives are upset, obviously, because they hate it.
So you're saying it's a combination of both?
Yes.
Okay. All right, well, let's close that topic. And we got your weather here for you. It's the bottom of the hour. So today we got a high of 28 with some snow showers and wind, if you couldn't tell. Low of 14 tonight, and tomorrow it's going to be a warm 19 degrees with a low of 13, more wind. Wednesday we got a high of 26, and it's going to get really cold Wednesday night down to 6, but should start warming up the rest of the week. Nothing like really warm, but back to those 25s and above. So, all right, Alex, you want to get us started on the next topic here?
Yes, we are going into, okay, so since we're talking about the Democratic struggle, let's go into Barack Obama is going to have his State of the Union speech. Now, all right, what do you guys think he's going to need to say in this in order to help these congressional elections? What is he going to need to talk about?
He's got his work cut out for him. I mean, what I don't know what you need to say. I mean,
I feel bad for his speechwriters.
Yeah. Mm-hmm. I mean, you really can't start with the State of the Union is good. I mean, we're in a huge recession. There's a huge ideological battle going on over this healthcare bill, and we're in two wars. I don't know what you say. I mean, you have to somehow encourage the markets, and you have to encourage people, and you have to try and get support for your party in the next elections. But I don't know. He has a bunch of stuff to do. I don't know how to even start.
I think he needs to focus on the economy, because that's everyone's key issue is the economy. He needs to say we're actually going to create jobs and we're actually going to help the economy, and have a plan and outlined how he's going to do this.
That's what I was going to say. I mean, he won a lot on. I mean, you guys may hate me for saying this, but he won a lot on fluff. He really had when he won the election in November. He didn't have a lot of substance. And I think people are starting to look past that, saying, okay, that sounds great and we're motivated, but we need a plan. You need to be a leader, and you need to give us an idea or outline some kind of legislation that you're going to do, not what you want done, what you're going to do.
He's got to explain he's got to make sense of everything. Because one of the biggest reasons people are upset at the healthcare legislation is they don't know what's in it. He hasn't been able to really communicate his goals very well in a way that people can say, all right, I get what you're doing. I can, watch it and see you go through the different phases of getting this done. You really can't do that because you don't even know what's in certain things. So, shall we have some headlines?
We could do that. Let's do that.
For everybody. All right.